we talked a lot last time about the tensions that exist between the public health model and kind of the practical, effective application of regulated markets, mainly recreational. We kind of moved into like a recreational discussion. And I know this week he's done a great webinar alongside Katya and Steve Rolls. What was the name of the institute? It's Reese's excellent organisation that works for in Australia. The begins with a P.
Yeah.
They're the
Penning,
guys.
Yeah.
Yeah, they're doing some great work down there. Big fan of Reese, just brilliant advocate. So you had a really interesting discussion around that. So when it comes to kind of these, public health models and proposals, do you sense a bit of a shift in the discussion and debate around the challenges of a purely public health model in eliminating illicit market, or are we kind of in the same place that we've been for the past few years, kind of discussing and debating those tensions? What's your kind of instinct?
I guess it depends what you mean with that. If you mean, do I see a shift in policymakers proposing cannabis reform or legalization or partial legalization, now considering other arguments that are not related to public health, for instance, a justice argument or something like that. And talking about that, no, I haven't seen any change. I mean, even within the own German coalition government, the discourse is almost purely about these public health issues and protecting kids and adolescents and regulating cannabis in the post legalization, or legalizing in a way that it's heavily regulated so that according to what they wish, only safe products are consumed and as little as possible is consumed, so discourage consumption. Basically, that's the way that it's been argued. I would say, in my opinion, unfortunately, because although I do appreciate the public health argument, you could say, I think it should be part of a package and not just legalized based solely on public health fanatism. So no, they're not. What I am seeing, and this is very subjective, really based on my own experience, but what I am seeing is that from the cannabis community in Germany or elsewhere, many people are realizing that perhaps this has been the wrong approach to propose legalization with a discourse that is 100% about public health, because we're missing a key thing here, and it's like the justice argument. And by focusing solely on public health, you are giving a huge stage to the opposition, and it's basically like a non-dialogue that has been going on between the government and opposition in Germany, with the government saying, oh, this is good for public health and for the kids, and the opposition saying, oh no, this is bad for public health and the kids. But nobody really has, I mean, and I'm all in favor for legalization and support the government, even if this is very limited, supported with what it wants to do. But it's really hard to say that legalizing home growing and clubs only is certain to have an extremely positive effect on public health. I mean, yes, of course, you could argue those that will be growing at home or at the clubs will have access to a safer product than what they would probably have access in the illicit market. But then the opposition also has an argument there that is not crazy, and it is that when you limit it to clubs and home growing only, there's a risk of diversion into the illicit market from there, right? And we may not like their argument and counter argue it in different ways, but yeah, we are giving the stage to the opposition to have the conversation based solely on public health, when there are other arguments that I think have no counter argument from the opposition, especially an opposition that claims to be about justice and freedom in other topics, let's say, claims to protect, to want to defend personal individual freedom. And if that were the argument that would be used for legalization, I think the opposition there would have no counter argument. And unfortunately, that is missing. And the other thing is that by focusing the conversation solely on public health, what you end up is with these hundreds of pages, literally hundreds of pages, in a bill that should be quite simple, right? But because the government wants to project this image of, we are very responsible, we know cannabis continues to be really dangerous, and we want to legalize it, but make your life miserable so that you don't consume. Basically, that's they are not saying this, but if you read between the lines, it's basically, yeah, we still treat cannabis as this extremely dangerous
Yeah.
substance, and we want to discourage consumption. And to do that, we are going to legalize it or quasi legalize it, but we are going to make sure that your life is complicated if you want
Yeah.
to actually use it. And then with this, like, look at this very specific, to go into practice and not just talk in theory about this, like a very practical example. The so-called legalization in Germany, the first pillar, which is about decriminalization and personal growing and jobs, actually uh, actually creates new crimes that are not crimes today. So, for example, today, with the new with the pillar one being approved, you would not be able to consume in public spaces. There would be like zones where it would be prohibited to consume, which probably would be all around the city. I mean, it was 200 meters from a bunch of things before. Now they are proposing 100 meters, or at least 100 meters. But at the end of the day, there will be quite a lot of restrictions. And even patients who today can consume without basically any legal issues, at least their cannabis medicine in public spaces, would be prohibited from doing so, and would be committing a crime if they do so. And why do we want to create new crimes in a so-called legalization bill? Or not just that, not just creating new crimes, but also um, uh, um, have uh, how do I say it? More like stronger, more years of jail time and things like that for
Yeah.
crimes that are already existing. Like, how do you say that? Like, harsher penalties, have harsher
Yeah. Yeah.
penalties
Yeah.
for already
Harsh.
existing crimes. So the government is all about projecting this image of, we care about the kids. So what they are gonna do if they approve the first pillar as it is currently being proposed, and we don't know what the final form will be yet, but with the final proposal, at least the one that is known as we speak right now, if you are, say, 23 years old and you share a joint with your 17-year-old brother or sister, uh, you may end up in jail, and you may have a harsher penalty and spend more time in jail than if you rape a kid, right? So it's kind of
Yeah.
crazy, right?
Yeah.
And why does this happen? In my opinion, it happens because because the government basically wants to project this image of, we care a lot about public health and we want to be tough, legalized, but have it all under control. And it's just an illusion of control, of course, because it's not real control. It's just an illusion of control because the illicit market continues to flourish.
Yeah.
Um, but yeah, so it's kind of sad, right?
It's very frustrating. But I share your frustration. I think me and you really sort of share that frustration with the public health model, and I think neither of us are naive to the need for public health and the importance of some of those arguments. We're not kind of like ignorant libertarians off. People should just be able to do whatever they want. We totally understand the tensions and the need to protect and have models that have that in mind. But it's that
I,
if you keep going down that route, it ends up being a model based on fear and stigma, and you end up just implementing models which reinforce that fear and stigma and kind of lose the consumer element. It
yeah,
just disappears. Everything becomes very bland,
I would
very
say
challenging.
that the stigma has been, unfortunately, at some points, with some statements and even with some of the text of the first pillar of legalization bill, the stigma has been reinforced, unfortunately. And cannabis has not been normalized. Quite the contrary. The
Yeah,
discourse from the government is, we do not want to normalize this thing that is very bad for you, right? That's obviously not with these words, but that's
yeah.
the
It's
message,
essentially that
the
message. Yeah,
message that they've been projecting. And yeah, so we're gonna tweak the laws and regulations so that we allow certain things, but within very strict limits, which is strict in theory, right? Because just like for instance, one of the things that are absurd in the first pillar bill is that you would be able to grow up to 3 plants at home, but then you would only be able to possess homegrown cannabis of up to 60 grams. So it's just silly, right? I mean, either the persons who wrote this have absolutely no idea about how much a cannabis plant could yield, or they do have some idea, but they still want to project this image of we're being tough with legalization and the rules, and and they don't want to have a loose regulation in terms of the number of grams that you could harvest and possess from your homegrown cannabis. So they end up saying up to 60 grams, because maybe if we say 1,000 grams, it sounds scary, right? So so
Children.
let's limit to 60, and that projects, again, it projects the illusion of control, that the government cares about public health and that they are going to be tough with the new rules. But in reality, what it will happen is that that will not be enforced, and because you cannot enforce that, or it will be enforced only with marginalized communities or people that are usually controlled by the police, let's say, right?
Yeah.
But yeah, it's these kind of things that are not really based on science or on good
Yeah.
public policy, but based on the the fixation on public health as the sole principle for or
Yeah.
argument for legalization. And as you said, it's not that public health should be ignored. Quite the contrary, it should be considered. But if you want, even if you want public health to be the main reason to legalize, I would argue that the best outcome for public health is a rapid transition from the illicit market to legal sales. So if that happens, to the degree that it happens and the speed at which it happens, that would be beneficial for public health, because people will be consuming a regulated product, right? But when you
Yeah.
make life miserable for the legal market, or if there's not even a legal market, you make life miserable for clubs and home growers, then is it really the best outcome for public health? I would argue that no, it's just illusion of control. But by making life miserable to the legal supply,
Yeah.
the illicit market continues to thrive. And although it may be well intended initially, in terms of we want to do this very controlled because we care about public health, the actual outcome will probably not be what it was intended. I'm not assigning ill intentions. I think most people are well intended, uh, the ones working on this. But unfortunately, I think that this fixation on public health has not been helpful.
Agree. As a kind of final point, then, as we look to 2024 and not just Germany, but just kind of Europe in general, how do we raise the debate and discussion around that point? Because one thing we said at VaultFast for a while is that the first stage of drug policy reform in Europe is to get to the point by which people recognise our laws aren't working and we need change. And that happens on both the left and the right. You know, the Daily Mail, we need to be tougher. They're still coming to the same conclusion that what we're doing now doesn't work. We need to do something differently. Our current prohibition doesn't work. And I think most governments have kind of reached that position, or most people who debate the issue are kind of like, yeah, we either need to enforce more, or we need to like liberalize. We need to change. And I think those kind of discussions have gone quite far. But there seems to me this other discussion that we've not had, that we're now sort of reaping the consequences of, which is we've not had that discussion around, well, what is the best way to regulate? We've got like North America essentially just kind of going for it and going, well, let's try this, let's do the other. And obviously we've got data now, data points gathering from that. But here in Europe, it does seem to be a discussion that we've kind of like the public health lobbyists and the kind of, I can't really think of an accurate word to describe all of them, but people that are kind of pro adult use, people that use themselves, or people that are just sympathetic to the cause and recognise it's more sensible. They're all kind of now around the table, but public health have got the microphone. It's public health that are like,
Yeah,
here we go, here's the model. And I guess for me, we need, as an industry, or just people that care about the issue, we need to do more to kind of get that microphone and work alongside public health officials, policymakers, to kind of advocate for some of these things. Because to me, it feels like a discussion that we've kind of forgotten about in our rush and excitement of reform. No one's gone, oh, hang on, we should probably get some economists in the room, because they know a lot about consumer choice and preference. And we should probably get some marketing experts in the room, because they know about how people are
we
influenced
should
by
probably
it.
get cannabis consumers. as
Yeah,
well.
oh, yeah, yeah, of course, yeah, yeah, no, of course, yeah, yeah,
Like, we should get cannabis consumers to also decide here, right? Like,
definitely, yeah,
they should not be outcasts in society for which the government is doing something without their intervention, right? um,
100%,
yeah,
yeah.
I mean, I agree with what you're saying. I, I do, however, I mean, I think that the part of the explanation is that those Europe. So there's an international law issue, and we've spoken about it before,
Sure.
and there's this limitation in terms of international law, particularly in European Union countries, that maybe uses an excuse to not go far enough, right? The international law issues, that has been an issue since over 10 years ago, when I was following very closely these things in Uruguay, my home country. That was the first one to legalize nationwide, and I remember international law was a hurdle. I know that the hurdle, and I know, and I warned that from day one in Germany, that in the case of the European Union, that hurdle is even bigger because of European Union, the European Union itself, not just the single convention. So yeah, there's that thing, right? Like, we cannot go far enough because of international law. And then the response with this sole focus on public health has been basically to tweak the system a little bit, right? Like, to do things that, but without much courage. I think that's what we've seen in Europe. And you have policymakers in Germany talking about a change of paradigm. I mean, I don't think it's a change of paradigm. What's happening? It's an improvement, although I disagree with some things, including having harsher penalties for certain cannabis-related crimes, including creating new crimes. I don't think it's 100% solely positive, the step forward, but overall, you could say, okay, it's a small step forward, the pillar one, but it's not really a change of paradigm, because cannabis is not being normalized, and it continues to be surrounded by stigma, even from those who are in favor of changing things. And I don't know, perhaps it's completely crazy and unrelated what I'm gonna say, but if you like history, you'll know about the so-called German economic miracle. What happened after the end of the Second World War? Germany in ruins, of course, and there was this Wirtschaftswunder. And a key part of a key reason of why that economic miracle occurred in Germany was that they didn't tweak a non-functioning system. They got rid of it, basically. So it was June 1948 when someone called Ludwig Erhard challenged basically the Allied occupation government in Germany by lifting price controls without asking first for permission, right? So there were all sorts of crazy price controls in Germany at the end of the world, and that end of the war, and that obviously price controls basically never work. And when you have an economy that is, yeah, with all sorts of things controlled by prices, you create scarcity, and yeah, all sorts of negative outcomes. That was not working. And yeah, Ludwig Erhard basically announced the lifting of those price controls without asking the occupation government for permission. And then he was summoned by the American General Clay, I think was his last name, who wanted to question him for daring to disregard the occupation government regulations, and announcing unilaterally, basically announcing the lifting of price controls, that at the end was a key reason of the economic miracle in Germany, right? But back then, you didn't know whether it was going to work or not, at least not with certainty. So when he was summoned by the American General Clay, about why he was amending the rules, basically, I think it was that, Ludwig Erhard responded, "General, I did not amend the regulations. I abolished them." So, like, you cannot complain that I amended the regulations, because that's not what I did. I abolished the regulation. I got rid of them, right? And I'm not saying that's necessarily what should happen with drug related laws, but I think we do need a little bit of courage, and not just think about a little tweak here and there and not go far enough. I think sometimes perhaps we do need to at least give some thought whether what the drug control, so-called drug control system and laws need are a small change here and there, and then a small step forward followed by a small step back, or what we need is actually to abolish prohibition, right?
Yeah.
Um,
A
yeah,
great point. I love that. I love a bit of history. I love a historical anecdote. Fortune
yeah.
favours the bold and the
Uh,
brave.
you
In that
can Google
case,
it. Google what Ludwig Erhard did in June 1948 and how he responded to the American general that was wanted
I love that.
to have his yeah.
Alfredo, you're such a pleasure to talk to, mate. You've got great knowledge on this sector, and really appreciate you taking the time out to speak to us about it here. And people should also check out the webinar that you recently did, which I imagine will be on Twitter, on LinkedIn. People can find it on your profile. I'm sure. Yeah, thanks so much for speaking to me, mate. We'll both keep an eye on this work, and I'm sure sometime next year we'll be jumping back on and kind of discussing that first pillar, see where it's at, and hopefully have some updates on the second pillar. But really interesting to hear your concerns and hesitancies around that its implementation. But I know it's an area that we'll all be keeping an eye on. So thanks so much, mate. Really appreciate your time.
My pleasure.